Well, hello and welcome. Thank you very much for joining our webinar this afternoon. I'm Shane and I'm a concept advisor here at Space to Healthcare. I'm very privileged to be joining this and hosting this webinar today along with the panelists we've got here. And so thanks for joining us either on Teams or LinkedIn Live. We'd like to invite you to ask any questions in the chat boxes and we'll try and answer them as we go along. So just to give a brief introduction to Space Store. So Space Store is the creator of architectural space-defining furniture that's a blend of California cool and London design. And we've learned with some of our long-term engagements with clients within corporate organizations such as Google and Roche Diagnostics and Pfizer, how their organizational goals really are helped by creating environments that attract people back into the workplace. One of the key goals we're seeing at the moment, and what we saw, I guess, mainly following COVID, is some of the needs within healthcare were similar to what we were seeing in corporate organizations, and a particular focus was on one of our products for the world's first video booth that was designed from the ground up to help with the telemedicine and virtual consultations that were a big thing that came to light following COVID. Now, we on this journey, we've been liaising with many healthcare companies, and we now would like to share how we can help each other on this journey of transforming healthcare. So with that, we'll introduce today's topic, and it's really about how we can transform healthcare through design, and particularly focusing on a key topic recently in improving staff wellbeing. So with that, I'd like to introduce our panel. So firstly, maybe Mel, you could introduce yourself, please.
Yeah, hi, Mel Jacobson-Cox. I'm from H&M Architects. Joined H&M earlier this year as a head of healthcare, and I kind of bring a strategic overview to our sector, drawing on my own sort of technical experience working in healthcare for the last 15 years.
Thank you very much. Very glad to have you today. Robert.
Hi, afternoon all. Robert Etchell. I'm a board director at Llewellyn Davies, but also probably leading up healthcare here for the last 10 years. Been designing hospitals since about 1989, so a bit of a track record there. I've seen quite a lot of changes through that time, and the interesting times we're coming into now. Good to see everyone.
Good. Thank you very much for joining. And Alex.
Yeah, thanks, Shane, and hello everyone. Good to have you all on the call today, whether you're on Teams or on LinkedIn Live. So as Shane mentioned, I'm Alex Harvey. My role is VP of Sales here at Space Store. My role is kind of split partly between our clients in the workspace sector and working with some of the corporate clients we work with in their offices and workplaces. So tech companies, financial services companies, pharmaceutical companies, the likes of Google and Pfizer and Amazon that Shane mentioned earlier, and then working with our clients in the healthcare sector. Specifically, I guess the kind of conversation and topic today will be focused around the NHS and the healthcare sector in the UK, but I know we're talking to an international audience. And welcome if you're dialing in from outside of the UK, because we'd like to share insights and experiences that will be valuable to you wherever you come from and wherever your expertise is. So excited to have the panelists today and be part of the conversation.
Good, thank you very much. So with that, I'd like to go back to the topic we've got today. So I guess, first of all, if we discuss the sort of what's caused this topic to come up about staff wellbeing and what's really driving some of the changes that we've seen within design and the whole area of staff wellbeing, what's driving this need for an improvement in staff wellbeing, I guess. So maybe Mel, you have some initial thoughts on this topic.
Yeah, I think the context is really, really important. If you look back over the last couple of years, it's been unprecedented what's gone on in the NHS and in the world as a whole. And I think the pandemic really brought an awareness of the NHS staff and the role they play and just the pressures that they face. And I think certainly the question of who cares for the carer came up pretty early on in the pandemic. And I think then there's been things that we did, you know, which made a huge impression on the NHS staff. We clapped for them for a long time, and then we stopped clapping, and I know that's had a huge detrimental effect on their morale. There's been recent sort of case study wellbeing surveys completed. We know that absenteeism and presenteeism and NHS staff being off work for post-traumatic stress disorder, for instance, it's prevalent. We know it's costing the NHS a lot of money. It's not great for a workforce at all to have these levels of difficulties, and staff morale seems to be at an all-time low. And there's constant kind of press coverage about, you know, the greatest workforce crisis in the NHS of all time. So I think it's now, you know, we really must address how staff are considered when we go forward and we design buildings and the environment in which they work.
Yeah, absolutely. Yeah, and I agreed that the NHS staff, particularly in England, talking about sort of over the pandemic, how they were the NHS heroes, and it's only fair that they have the same environments and have a good staff wellbeing as anyone else. So I think it's an important factor that they are cared for rightly. Rob, you have some thoughts too to add?
Yeah, sure. I mean, I spent a couple of days ago, I just spent a little bit of time looking at some facts and figures, and it's just for the NHS. I mean, I was looking back at, you know, I think the Nuffield Trust do quite a few reports on staff sickness and NHS performance, obviously. And in 2015, the NHS spent £2.4 billion on sick pay, which is like 1 in every £40 of the total budget of the NHS. And in that same year, I think the NHS England chief exec found £5 million. So £5 million of that 2.4 billion to try and improve the well-being of the NHS staff, whether that was health checks or physio, or they were trying to deal with, I think at the time, GP burnout. I think GP burnout was a big thing 7 years ago. And I haven't really found the facts recently, but you've got to think that through the pandemic and where we are today, that's probably in a pretty bad scenario. I think something like 500,000 work days were lost in the first quarter of this year for the NHS, which are big figures, predominantly down to stress and anxiety and depression. So yeah, it's obviously a big deal. I think within the design industry, we've always had a weathered eye on the fact that, you know, everyone was talking about for years and years, hospitals have to be patient-centric and everything for the hospital. And then probably maybe even 10 years ago, they were starting to think, well, hold on, it's the staff are there every day of the week, every week of the year, not just coming in for 3 days. Perhaps we should start looking after the staff. And I guess that kind of did get a bit of lip service. But then if you look at things like the health building notes, there's nothing in there for staff well-being. You know, they might get a 25 square meter staff restroom that's got about 18 chairs rammed in it and a couple of dodgy microwaves and a couple of kettles. So you think that perhaps the new wave and what we've learned off of Pier 5 from 20 years ago, and let's hope we have learned something, is the next wave of these 40 odd hospitals, whenever they do turn up, or whether it'll end up as 40 odd refurbed car parks, I don't know, whatever we get, that more money and thought is put into the staff. And that's, again, internationally as well, we're seeing a big move into that as well.
Yeah, I completely agree, Rob. I think that the recent sort of findings I've heard of is the IPPO 2020 NHS staff wellbeing survey. I think the figure they came up with was £12 billion a year. Currently, is the issue that the NHS staff are facing, that the cost that they're facing due to absenteeism. And I think that's kind of a staggering amount of money. And I think it's, you know, part of the presentation that I took part in was that there was a sort of attitude that we could spend that sort of money on stuff to sort of solve the problem, but there wasn't really much discussion around the workplace environment, which obviously as a designer, that's where I'm coming from. And you're absolutely right. There's in the HTMs and HBMs that softer well-being approach isn't really talked about. You know we need to provide facilities for staff. We don't really talk about the quality of those facilities, and I also don't think it's just about providing staff facilities. I think it's about providing a whole building experience. It's really great for patients and really great for staff. It's that holistic view, you know, so that the whole place is the well-being is put at the foremost. That staff feel, you know, valued. They feel like they're working with pride in an environment that makes them proud to be there. The environment's beneficial to how they feel, but also beneficial to how their patients are feeling, so that you're getting the maximum efficiency out of the service that's being provided. You've got patients that have got reduced anxiety because we haven't induced anxiety by putting them in a horrible space. You've got staff that have got reduced anxiety and a better place to deal with patients. So it's got to be the right approach. And so often it hasn't been the right approach. So often, you know, staff rooms have ended up being sort of converted storerooms or cleaners' cupboards or a couple of broken chairs with a sink and a toaster. And you hear sort of awful stories of handovers happening in places where there is no daylight. There's not even a window that you can open, and everyone's crammed in there trying to make the best of a situation.
Yeah, absolutely. I think it's key, and it's interesting the NHS plan that for England that was released back, I think it was back in July, that their first point was about improving staff wellbeing and around retention, which I think staff wellbeing is probably one of the biggest things in retention of staff. Alex, you probably has some experience from that. It's been one of the biggest drivers in the corporate sector with business recently, hasn't it?
Yeah, it has, and it's been a driver really for probably 10 years, 10 plus years, I would say. I guess kind of stereotypically, it was kind of kicked off by some of those crazy Google offices in the 2000s, and it was just a totally different approach to what we had seen previously. The office was just a place to come and do your work, but suddenly turning the workplace into actually one of the tools in the toolbox of that organization, of that corporate, as a way of attracting the best talent to come and work for that organization, was a completely different approach. And that's had a massive knock-on effect, you know, from tech companies through to almost every sector you might care to think about. And I think it's interesting what we're talking about here around staff wellbeing and related to attraction and retention of talent, and how that impact is going to be felt in the healthcare environment, because, you know, there's huge amounts of pressure and huge amounts of stress experienced in the NHS, you know, particularly in the last few years. But it's also, there has been that, and there probably is still some elements of stress in the corporate workplaces that we're talking about. So we've seen some real benefits to the organisation, but also crucially to the individual, because that's really what we're talking about. Is that this is about people, this is about individuals and their workplace experience, and them being able to perform to the best of their ability.
I think that's key. People is key, and actually it's about community. It's about engaging with the community, whether it be a wider community or whether it be your community of people that are working for you. And I think that brings in the whole question of stakeholder engagement and how you show that you are listening. What needs to happen is that we need to be seeing people for their needs, and we need to be listening to what they need. And whilst the NHS might not be able to provide everything that they do need, then I think this is where the greater community can come into play, that we can look at where we can join up in the wider community with leisure centres or facilities that can then help to assist. And that then starts to make sense of the new ICS system, which is coming, which is replacing the CCGs. And I think that's key. It's community is about people. It's about those individual stories and those individual needs, and then collectively providing a support for that to get the best out of the community. And whilst the community might not know exactly what they need, they do hold the answers. So I think we've got an obligation to ask those questions and to do proper stakeholder engagements.
Yeah, just on the back of that, I think the stakeholder engagements and actually asking people what they want is so important. A project we're working on at the moment, it's in the Channel Islands. It's not the NHS, but it's not a million miles away from the NHS. They out of the 70,000 square meters of building, there was 2,000 square meters given across to a staff wellbeing centre, and they had the foresight there to include that space, but never put any prescriptive description of what actually that's delivering. that we actually held these big kind of health worker panels, and that meant that not just asking the lead consultants or the lead cardiac surgeon, actually everybody that works in the hospital, what do they want to do with that 2,000 square meters? And some of the, I mean, everyone assumes, you know, it's all staff rest areas and staff rooms and, you know, rooms to do yoga in, but actually those things are important, but not as important as half the staff actually ask for decent changing facilities so they can ride their bike to work and shower and have dry rooms to dry their clothes before they go home. A big thing was for like just to be able to access hot food at night and at weekends, car parking, security. So there's a lot more than, you know, these kind of leisure lounge Virgin breakout spaces that you imagine in business lounges in Terminal 5 being replicated in hospitals. I think there's a lot more to that, and it's important to ask the staff what they want. It really is.
Yeah, and I think we're beginning to work with current project we've got is working with the trust to find out how we ask those questions, and actually how can we cast the net wider than traditionally would be envisaged. I mean, I think my experience, stakeholder experiences, has always been quite a kind of finite group of people. And as a designer, the finite group tends to grow at different stages as other people come on board, and actually gets quite hard to know what we're designing for. Whereas actually what we've tried to do is think about how could we open this wide open and get a much broader range, still asking the same questions, but across a much broader range of people, and then use that to then filter down into the people that want to carry it forward, and that's where the energies lie. So, you know, for instance, we're thinking about, is it, you know, an interactive engagement process, an app process, for instance, that's fun and visual, that can actually really engage with people rather than lots of words and asking lots of questions in a kind of language way, actually showing them examples of what it could be, and just gauging a better response. Because again, if you ask 10 people 10 questions and you ask 200 people 10 questions, the overall percentage result is not going to be any different. It doesn't make it any bigger, it just gives you a much more reassuring percentage factor and confidence that you've got the right answer.
The other thing on stakeholder engagement we see with a lot of our clients is it's not just a one-off event. It's actually, it needs to then be revisited as the space comes into use. We've seen a lot of clients in the corporate sector looking at just trials and pilots, so maybe just trying something different in a corner of the office or in an area of the office, and if it doesn't work, well, you know, let's change it. You know, we have to experiment and try new things, otherwise we're going to continue having the same issues.
Absolutely, and I think that goes back to, if you can kind of assemble our vision of the space or the project or whatever, and then you have something to then measure the outcoming designs. You can then look at the outcoming design and input at sort of, or output at stage 2, and sort of say, okay, are we actually getting everything we wanted, or do we need to, have we lost something here? Because what you want, you know, it has been, because we've been so patient centric in our design, it's so easy to say, no, the patients need that, it's more important the patients have that, and forget about the staff facilities, or forget about the sort of breathing space that's needed, the softer aspects that go around the kind of hard clinical design areas. And I think part of our responsibility to architects is to kind of hold firm on that, say, no, it's really important, these spaces are as important as your clinical spaces, and you need both in order to, you know, manage your service going forward. A good example of that is in mental health. We've been looking at seclusion rooms, and actually what we've been looking at is an approach to seclusion room design, an ideal design for that, but alongside that, a space for staff to go to use afterwards, because it's a distressing situation and it needs a degree of decompression, and that's seen as part and parcel. It's not just a seclusion room in isolation, it's also about the staff facilities that accompany that. And I think it's thinking about it as a parallel. Neither party is more important than the other, but without staff functioning well, there is no NHS, because it predominantly comes from the staff.
Yeah, I think another good point to pick up on there, Mel, is probably that whilst most departments within hospitals are quite siloed, they've got their own little teams, and they talk about endoscopy for 12 hours a day. It was deemed, I guess it has been in research and will be in healthcare, is that actually to get people from different departments to sit in the same room and have food together is a big benefit. So whilst we do need things like staff rest within each department, it's quite important to have a central zone where people can go to, maybe if it's decompression after work. Obviously people don't want to do a 12-hour shift and go spend 2 hours in a big staff restroom downstairs somewhere near the, you know, but they do want somewhere they can perhaps go and have a chat with other people that aren't necessarily from their department, just to understand how the rest of the world works. And we've seen a big push for that in the project we're looking at the moment. They just want some quite adaptable space where they can, instead of sitting down with the same people day in, day out whilst working with them, is actually go and meet the other 3,000 people that work in the hospital.
Yeah, and I think it's that shared community support, isn't it? There's your support, rather than logging onto an app at the end of the day and telling the app how you feel. Actually sitting down, rubbing shoulders with people, talking to people, being listened to, being seen, being heard. That's all fundamental human interaction. That's really, really important. And I suppose we've become so virtual and so siloed over the last couple of years that we're not doing that. We've become, you know, it's great that we've got our own resources and we can dig deep and be on our own, but actually there are times where a problem shared is a problem halved. And I think we need to provide spaces where that interaction can happen. So if people that want to do that, they can do that. I think if you don't provide the spaces, it certainly can't happen. And there'll always be elements of people that don't want to. There'll be people that want to take themselves off and deal with whatever they're dealing with on their own. And I think, you know, that it goes back to kind of similar to what Space Store provide. They provide a range of spaces and environments. So it can be a kind of collective getting together, forum, discussion, rubbing shoulders. It can be a private meeting to talk about something, or it can be an individual in a, you know, sound sealed booth, having that confidential conversation they need to make in order to make their lives better. And I think you need to be able to provide all of these facilities.
Yeah, actually, that confidential conversation is quite interesting. A lot of people asked that they didn't, if they were going to go and have a room where they could talk to HR or have a cry or something like that, whatever the needs are, it's that those rooms have quite discreet entrances, and you don't walk through the centre of something else to get there, so everyone knows where you're going. So that obviously plays on your mind when you're designing those spaces, that they're whilst they're great to have daylight, sometimes they need to be near the circulation cores so people can just nip in there without everyone knowing what they're doing or the problems they're having.
Yeah.
Sorry, Shane.
Sorry. I was only going to say, as trustee of the week, and one of the staff there was saying how he wants to have a discussion with his manager, but there wasn't anywhere to go, so they ended up being sat outside on the table, and then it started to rain. So it's sort of like, then it just sort of shocks you when you actually realise they haven't got the spaces they do need sometimes to do what they want to do. Sorry, Mel.
Yeah, no, it was interesting. It came out of Wellbeing survey. I think we're very good sometimes at providing outdoor space, but we're not very good at providing different spaces within the outdoor space. And quite often they're courtyard spaces, so they're overlooked. And actually something that came out was the ability to go to an outdoor space and not be overlooked, and just be able to kind of have a shelter that wraps around you, gives you some shelter from the rain, for instance, and provides that privacy. I thought that was a really interesting point.
Yeah,
and often it comes back to choice, doesn't it? What we're seeing, and what we've seen for many years, is an understanding of the different personalities and the way that they may prefer to work, but also an understanding of the different types of tasks that somebody may be doing on throughout the day, and then also maybe just my personal preferences, just because I had a bad journey to work this morning and I want to go somewhere and just kind of get on with my stuff without anybody around me, and that happens as well. So it's creating the element of, or the possibility of choice, so that people can function effectively. I just wanted to take you back though, Mel, to something you were discussing earlier, and be interested in your comments, and Robert's as well. So how do you so if you're faced with a skeptic who doesn't really see the value of good design and how that impacts on people positively, how that impacts, we've got the title of our webinar around putting staff at the centre, staff wellbeing at the centre. What's your kind of argument to someone who doesn't really see the impact, or hasn't seen the impact of design on people and wellbeing?
I think quite often people with resistance are coming at it from a cost point of view. They see these wellbeing aspects as bolt-on extras, and they come at cost. And I think actually when you deep dive into transformation within communities, quite often you find that the solutions are actually very cost effective. They're actually very low key. It is sometimes as simple as having a cup of tea in a pleasant space. So I think that would be part of my argument, is that it needs to be integral. It needs to be built in right from the beginning of a project. Otherwise it becomes bolt on, and it becomes seen as additional. And that's fundamentally, that's a culture change. And I think the other thing is that you know, the NHS know they're not listening. Well, they know from the staff issues that they have, the staff aren't feeling listened to. So they've got to sort of demonstrate that listening. You know, both that they're listening and they're receiving the data and they're then processing the data. That would be my kind of argument. Make it integral. Don't see it as bolt-on extras. If it is something that's perceived as costly, then let's look at the wider community. Let's see whether we can join up with a leisure centre or some other facility that can provide a service, and then you get that kind of interaction at a sort of wider community level. That would be my approach.
Yeah, I mean,
Interesting.
absolutely everything Mel said there, I'd repeat. And I guess when we do meet these skeptics sometimes, and they generally are the bean counters, but only because, you know, they have to make tough decisions. So sometimes you've got to make really tough, uncomfortable decisions about what you can and can't have. And sometimes some of the soft space is the easiest things to make the decisions about. But I think we take these people to other schemes, to other hospitals, and show them where staff have been put first in some of the design decisions. We show how that creates ownership of buildings, and then their different attitude to way how those things are looked after and not smashed to bits over the first 3 years of their life because they feel like they had a part in designing the building itself, and giving those people a voice, making sure that the strategic kind of leadership teams, and especially the people you meet that come from a core of high level of healthcare workers that sit at the big decision making of when they're looking at new buildings, or but you know, you'll always get that there'll be a design champion from the clinicians, and there'll be a couple other clinicians that are given the job of delivering a new building. But you've got to make sure that, as we said before, you get those health worker panels and you give them a voice, and that voice is heard as high up as you can. But you do need board level buy-in on all these things to enable it to push through, otherwise it does just get washed away. That's for sure. And the same in anything, not just the NHS, or same for everything.
Yeah, I was just thinking that we've seen a lot of change in our corporate clients, and you know, where it used to be the kind of real estate or corporate workspace and what it was, they used to have either their own separate silo or they're reporting to finance. Now you're finding that actually they're reporting to HR, or they're very closely linked with HR, because there's a recognition that, you know, this isn't just a standalone. This has a massive impact on the people, and a closer engagement. Yeah, as you say, there is always a healthy tension between finance and maybe HR, and that's a good thing. But a close relationship where we can actually figure out what's the best we can deliver within the budget that we have, so that, again, as you say, ultimately people are at the centre of the design, and it creates not just a patient-centric but also a staff-centric workspace.
I think it's been useful when we're considering, you know, an approach. We've been looking at the WELL standards again, and it's not typically applied to healthcare buildings. It can be kind of quite a costly experience to go through that, but still the criteria that's covered within WELL standards is really applicable, and it, you know, covers everything from, you know, air, water, nourishment, light, fitness, comfort, community, and actually, you know, and those incorporate aspects of safety and nature and art with them as well. And those are kind of those holistic areas. That soft stuff, again, you're not going to find an HBN on any of those particularly. Maybe to some degree water and air and light, but it's fine. It's kind of looking at those areas and making sure that those are considered alongside the design, and then you get that kind of that more holistic approach. It doesn't cost anything more to put a window in that gives you a good view than it does to put a window in that gives you a rubbish view. And it's kind of putting that at the forefront all the time, just always trying to find the opportunities. I say that a lot in healthcare design. Let's find the opportunity here. We do a lot of work that isn't glamorous, that isn't, you know, that is your backlog maintenance, but we're always trying to find the opportunity to make it a bit better, just to improve someone's life somewhere, because ultimately that's why we are healthcare designers. We are about making people's lives better, really, and that's what it boils down to.
It's interesting. I've just got a question on the LinkedIn Live. Kat is asking about whether either you have any research findings around NHS staff needs in order to improve wellbeing. Is there anything that either of you have published or that you could share?
I haven't got any of that personally, but I know the Nuffield Trust have got quite a few papers on actual staff communication and also looking at what the NHS or employees are looking for. I think you just go on the Nuffield Trust site, you'll find quite a few of them actually, and they're quite interesting because they'll come up with things that you wouldn't even have thought about. That's it.
Yeah.
The Nuffield's a good aspect to that. I mean, most of the stuff, but it's a difficult one because when you come to design clinical rooms in hospitals, there's loads of evidence-based design on whether it's environmental or size or activity space. There's lots of information on that. There's not so much feeding into evidence-based design on the softer things, and it is something we could really do with because it will add a bit more power to the elbow of not just us as designers, but the NHS as employers of what they can and can't spend their money on.
Yeah, funnily enough, Rob, that is what we're looking at with this design guide work that we're doing for a trust. It's exactly that. They came to us looking for a design guide on the softer aspects, and actually through it, we've said, is it a design guide? We don't want yet another piece of paper sitting on a shelf that gets pulled out and then forgotten about and has to be updated. Actually, that brought the whole idea of a platform-based, interactive stakeholder engagement series of questions, looking at the WELL standards and a light sort of touch. And the idea would be that you could then survey almost, you could actually get people to allocate their preferences, so you could then see for that trust what the emphasis should be. And it's a high level idea, but again, it would kind of provide data that you could then use with different stakeholder groups. You could actually then see at the sort of chief exec level what the priorities were, and then you could actually see on the ground what the priorities were and see whether they match. And I think it would be really interesting. It could be a live thing, so you could cumulatively generate the overall approach of what's needed. So I think you're right, there's absolutely a need. This is quite hard stuff to measure because it's quite subjective. Therefore, it's got to be a kind of a soft approach, but there also needs to be some rigor in it so that you're not spending money and time on an area that's not needed, that won't be used, and ultimately just becomes another redundant space. For me, as a designer, I want my buildings to be sustainable. I want them to know that they're going to be used going forward. They've got and that, I think that comes out of the stakeholder engagement. If you properly engage with your community, you are going to provide a building that they want and need, and they're going to use.
On that playbook thing, that's an interesting one as well, Mel, because obviously the NHP are generating a playbook, and it's not been shared, but it'd be interesting to see how descriptive it is on staff well-being within that, because I can imagine now they're looking at government budgets or the country's budgets and thinking, how do we make these things cheaper? And sadly, that kind of stuff could disappear quite quickly. But then, as we said before, even in 2015, the NHS was spending 1 in every 40 pounds of their budget on sick days. So there must be easy ways to perhaps look at trusts that have spent a bit of time on staff well-being, in the sense of it. Trouble is that there's one thing of designing a space and saying this is here for you to use, but then there's the whole culture of wherever they're working affects them just as much as the building. So there's we've given a really lovely garden on top of a roof where they can go and decompress, and it's got great views over London. It's amazing, isn't it? And then the next thing is there might be a culture within the hospital that means they got a turnover of more than 10%, which is more than the rest of the NHS. So it's really hard to quantify, really. It really is. It's a tough one.
And I think you touched on a really good point there, that it's great to have these wellbeing centres that people can go to afterwards, but actually there's a need during the day. There's a need to be able to go for a cup of tea or take a break or a rest, which is local. So I think it's whilst I think wellbeing hubs in a larger scale are great to put in, I think it's got to be part of the departmental design. And part of backlog maintenance should be about injecting where they can some spaces into the department so people can get that kind of rest and rejuvenation. There was a really good quote from a couple of weeks ago. Someone described the NHS workforce, but similar to, or the clinical workforce, similar to elite athletes who, with regards to their training and the rigor and the dedication they need to show to their job, but they don't get the luxury of the rest and recuperation. And I thought that was a really good way of looking at them. They're constantly having to perform, and yet they don't get the downtime and the break from it. They often take their work home with them, so they're not even getting a break at home. And so I think we've got to address how they are feeling during the day, and so that if we can in any way kind of alleviate them taking stuff back with them, and in any way support them better during the day, that's got to be a good thing.
Yeah, but if we look at the design as a whole, as any hospital, I think there's been lots of talk over the past kind of 10 years, Mel, on, you know, biophilic design and making sure there's as much of nature in the buildings as possible, and that all goes towards well-being of not only patients but also staff.
Yeah.
So that it's a lot more than a snazzy little room in a staff well-being centre. There's a holistic approach there we need to have to design that enables all of these things.
Yeah, and I think I think the projects like our Hull Oncology project was designed exactly along those lines. It was about the entire user experience, both patients and staff, and it wasn't about, like you say, you know, a nice staff room. It's more than that. It was about that, you know, the building itself just felt lovely, and it is generous, and it is full of well-being and good views for everybody to take advantage of, and for everyone to feel good when they come into it and feel like they're in a therapeutic and healing environment.
That was the exact word that was playing in my head, Robert, as you said it, holistic. This is, you can't just fix things with, you know, a room or a set of rooms. But I'd be interested in both your comments around what about an existing hospital where they haven't got the luxury of a complete redesign? Yeah, have you seen any successful examples of where clients have been able to do something to make a difference? And, you know, as we've said, some of the staff wellbeing spaces currently are, you know, no natural light in a small kind of store cupboard that's been converted. You know, what could organisations look at to do something better than that, but that doesn't involve a complete building redesign?
Yeah, I mean, we're looking at the projects at the moment in Oxford, and it's to extend the critical care unit within one of the Oxford hospitals, and they have currently got a staff restroom that is 1.5 meters wide, with 10 or 15 chairs in it and a door in and no window or anything. It's pretty horrific. Bearing in mind they're working in a critical care unit where it's pretty intense. You don't get quiet times. It's full on. Everything's full on. You get your magical 20 minutes or half an hour's break, and then you've got the option of going and sitting in a corridor that's got a door in it, or going downstairs or trying to find a bit of away space. But in the big point they made, and it was probably, that's again back to people power, is the staff said we need somewhere better. So part of the redesign is they do get a much better staff restroom that actually does have a door that opens out onto one of the courtyards that they have within the scheme, existing scheme. And it didn't take much. It just meant you had to shuffle around a few priorities and perhaps use space more wisely.
Yeah, I mean,
so
similar. Yeah, it is doable. And I think also where we've got a couple of projects in Wales where we're going through the estate, Prince Charles Hospital in particular. And I think it's about injecting and working alongside the trust art strategy as well when you've got an existing building, and trying to get some cohesion into it. So, you know, thinking about, again, art and colour and wayfinding are actually really important. They're really easy ways to incorporate a better feel to an environment. Quite often it comes along at the end and it gets bolted on, again, tacked on at the end, and it becomes a bit incongruous because it doesn't really mean anything. And if you can get that engagement early on with the art strategy, get the buy-in from, you know, the users of the building, be it the patients or the staff, about whether there's a theme or there's some context they want to, a local context they want to represent, or something that's important to them, then that can really help. It can help with your kind of choice of colours for finishes, but also you can then think about engaging with the local community art, and it becomes meaningful to them. And I think that's where you have a lot of success. You know, there's a lot to be said for good paint colours, good graphics that are used, and they don't cost the end of the world, and they can make a huge difference. Even the sort of light boxes you find that go into ceilings, with the kind of sky view, you know, they're clearly you're not outside, but actually they do make a huge difference to those spaces, and they can really enliven them. So there's a lot that can be done that doesn't cost the end of the world, and can kind of benefit the existing spaces that are left.
Yeah, and art strategy is a real good one, because art strategy again isn't just about a couple of paintings in a corridor. There's so much more to it, and you generally want to do a program of activities that are built into your art strategy, and that's really important for staff, like really important for staff. But somewhere like Great Ormond Street do that really well, really well.
Yeah, absolutely.
We've just got a question in the chat, just to quickly go over. It is sort of talking a bit about what we've been discussing around the NHS focusing on staff wellbeing. But I think what the main point in the question really is how can we increase this pace of change to making staff feel properly valued and creating these spaces. Any comments to add on that, Mel or Rob?
Increasing the pace of change is quite difficult. I mean, there's if you take the PFI schemes, for example, they've got a constant, the big PFIs have got a constant churn of making sure the operators keep the buildings up to scratch. They've got quite a big budget, and it's not just a budget for repainting walls and fixing doors and door closers, which we know always break in hospitals. UCLH are quite good at using that and leveraging that money that's built within the PFI to actually update spaces for the staff as well. So they're always doing it. It's been particularly difficult over the last few months because obviously a lot of the money's been taken back to centre for the NHS, and they're holding on and slowing down projects and probably getting ready to release it again for, well, if they do, it'd be for January or something like that. So there is a general slowdown, but I think it doesn't take a lot of money to refurb or move a staff rest room. It really doesn't. It doesn't take a lot of money or any money to listen to what staff want and actually actively engage with them. And to be honest, it's that kind of stuff is secondary. That it's much more important to create team spirit and cohesive leadership within the NHS than it is for how quick the kettle boils the water. So again, we get back to that big holistic kind of word. But yeah, at the moment it's particularly difficult. It is difficult, but there are means and ways of doing it, and pushing into that. Have a look at your arts fund, see what's in there. If it's not been cleared out, make a case for it to be used for the staff.
Yeah, absolutely. I think we just have to champion it as designers. We have to champion it right from the start. I think if you hold firm, and these kind of conversations are great because they're bringing a lot of awareness to how we're thinking about it, to people that maybe haven't thought about it along those lines, because people very much have their kind of roles, and it's very much down a sort of tunnel vision. I think that's what we have to keep on championing. This is the approach. It's one thing to say we've got a problem. We've got to address that. And actually, there was I commented yesterday, obviously, on the new NHS plan from the Health Secretary. It's a plan for patients, and I said, but the first one of the aspects is about increasing staff, in the NHS. And I said, so what's the plan for staff? If staff are so integral to the plan for patients, what's the plan for staff? How are you going to keep them? How are you going to encourage them to want to come back to their jobs? How are you going to retain them? How are you going to make sure they feel valued and appreciated so they don't go again? I think it's fundamental that we shift this patient-centered approach to, we have a saying which is well staff, better patient, which I love. I think it's a really, really good saying. If your staff are well, your patients are going to be looked after better. They're going to get better quicker. So that's ultimately the goal, but the enabler for that is this well staff approach. And I think we just have to keep on talking about it and championing it and try and change the mindset, which is every last piece of money needs to be spent on a patient facility. It's been particularly challenging over the last couple of years because they've had to increase clinical facilities, separate them out because of COVID. Every last piece of space of an estate will have become, has been used, and things have changed just so that they've got another room, they've got another isolation room, they've got another, clean utility or whatever they need. Hopefully we can kind of readdress that balance. I think also part of the whole shift with the ICS is as well looking at what can come out of our hospital estate in terms of freeing up space. What can move into the communities and sit in the community at that sort of primary care level, come out of the hospital estates, put some breathing space into these estates that can then allow for a better refurbishment or an expansion, I think also is really key. So I think there needs to be a good sort of asset management of the existing estates, you know, a really good rationale. Why is this in here? Is it needed? Can we move it out? Can we provide a better service in the community? Does that free up space within our hospitals? Can we then start to transform our hospitals?
Yeah, and I guess if you need to start really thinking outside the box as well and looking at where else you can get investment, and wherever your hospital is, doesn't matter what part of the country, what part of the world of it is, corporate responsibilities of your local businesses is really big now, especially if you're near large corporations. I mean, you've only got to look at the kind of money the fossil fuel companies are making at the moment, that they must have a big tag of that they should be pushing back into the community. And I think perhaps instead of it being a sideline, is look quite heavy at the way you can get your charity to build some corporate relationships and get them. I'm sure if you ask one of these big corporations to help you improve the well-being of your staff by giving them a better staff restroom, you probably have companies falling over themselves to provide it. And people like, I know Sheffield Children's Hospitals, the paediatric hospitals are really good at it because it's quite easy to ask for money for children and for people that look after children. And obviously, you know, you've got trusts like Gosh that are overly too good at it, perhaps, and take way too much of the percentage of what goes to the NHS as charity. But again, they look at it as a business, and they think out the box, and you know, and perhaps that's what we as designers probably can bring to the table and say there's other ways of generating cash or means of doing things, and then the actual NHS and trust themselves need to think of it as well.
Yeah, I'm hopeful that the ICS change is kind of encouraging those kind of collaborations. I think it's going to take a while for the NHS to realise that they've been sort of all insular themselves, and that they can break out and they can look to the wider community. I'm hopeful that change will come. I think again we need to kind of push it along, and actually bringing in experience from our other sectors as an architectural practice is really key. What's been done in the workplace sectors, or you know, for instance, or sort of master planning approaches, I think is also really good to kind of share that knowledge, because I think sometimes we go down the rabbit hole of healthcare design and we forget about the outside world.
Yeah, thanks, Mel. That's very insightful. Just conscious that we're just ticked over time, so I don't want to keep everyone hanging on. But it's been very helpful discussion. I've definitely learned a lot, and I think key takeaway really is putting the staff first, and like Mel was saying, well staff and well patients, and getting their engagement to help us direct design for improving staff wellbeing. So I'd like to thank everyone very much for joining. Thank you for the questions that have come in, and thanks to Rob and Mel for joining us and sharing insights. Been very helpful. Thank you very much.
Pleasure.
Thank you. Thanks.
Yeah, echo that, Shane. Thank you very much, Mel. Thanks, Rob. Great conversation.
Cheers, Alex.